Hello, all. It's Latoya again. I'm here talking about the ACDF surgery, 3 levels, the 4 through the 7, with the corpectomy. I ended up getting a corpectomy. Um, it's the second day I'm at the hospital. Surgery was yesterday. It's about 6 p.m., so it would be exactly about 24 hours to when I got to this recovery room, well, to my own room, my private room here. Um, I don't know if you can see my incision, but my incision went more across the front of the throat. They decide which side or where they're going to cut you at according to how your veins are lying when you're in there. So he explained that to me this morning when he came to visit. He said it looks good. They didn't staple it, they glued it so that it healed over really good, hopefully in the crease. It won't look too bad like a scar. But that's that. Um, I'm having some pain down what I would say is if this was the back of my neck, it's coming straight down the back of my neck into my right shoulder um, blade up under a little bit. It's very discomforting, and it's kind of been like that all day. The swallowing, it isn't crazy, but it does hurt a little bit while it's going down. But if you get one of these nice aspen collars like this, if you turn the button, you can lower this down when you eat. As you see, it came down. So when I eat, I take it down so that the food will go down a little bit better. But as soon as you finish eating, you need to put it back because I had forgot and I left it out when I had lunch. I left it. I didn't eat solid yesterday. I ate solid today, but I ate my breakfast, lunch, and dinner today. I should be going home tomorrow, but the doctors and the nurses I had were pretty decent. Physical therapy comes in, evaluates your walking, your strength, see how things are going for you. If you have stairs at home, they're going to walk you up some stairs and check to see, if you can make it up the stairs. Social worker comes by, see what kind of equipment and stuff that you need to go home with. Really, really good stuff. They take really good care of you. I feel like they do anyway. I had a good doctor, Dr. Dennison. He was awesome. Um, I went and got this special pillow. This is something to get. If you look at the pillow right here, it has a hole in it where your head goes so that the brace is sitting in it. So my head is actually imprinted in the pillow. And it was only $19 on Amazon. It's a good buy. When the physical therapy lady seen it and I showed it to her, I asked her if this was good. She said it was great. And it was only 19.99 on Amazon. And if you're a Prime member like me, yes, it's free delivery. So do get you one of those. And again, I'm just having some, even though I have my pain medicine and I'm on 2 types of pain medicine, and even though I had that pain medicine, my neck is still hurting now going down the back. It's not destitutional. It's probably, mm, when you talk a certain amount, you'll feel it, your throat sticking a little bit after you talk so much. You just got to kind of let it pass. Um, I would say my pain level right now is probably maybe like a 5, 6. So, it's still moderate pain, but it's not destitutional pain by no means. But I did just have my medicine about 30, 45 minutes ago. So I'm really waiting for that to kick in. But outside of that, I feel all right. It's not too bad. Um, Nothing else much really going on other than that. Just, you be in bed a lot, get poked and sticked on a lot. Boy, I didn't been here. You got to have this needle and that. It's got one in my tummy, to keep the blood clots from coming. Um, just different things. You don't really get much rest at the hospital. Well, I didn't. Well, I'm not because they're coming in like every hour, 2 hours, checking your blood pressure and, giving you medicine or just whatever they do. So it's not really restful here. So I'm looking forward to going home to where it's quiet at. Nobody's really waking you up and stuff. So I'll be happy about that. They do want you to get up and sit in the chair though the second day. So I got up and I sat in the chair at 6 o'clock. My doctor came in at 6:45 and I was sitting in the chair to about 3:34 in the afternoon because you want to do the things that they're asking you to do so you can go home. And I'm trying to comply with everything so that I can be able to go home, get the real rest that I'm hoping to get. But right here is hurting me a little bit too from where it was swelling at. But they give you like prednisone to try to take out the swelling in your neck. So look for some discomfort in your neck. It's not destitutional, but it is discomfort. And the same with the back of the neck. That's where my plate is at though too, in the back. So it's discomfort back there on this right side too, on my shoulder a little bit. But other than that, it's good. I'm thinking I'm feeling a little bit more now because it's been 24 hours since I had the anesthesia, and I think I'm relying solely on the pain meds now because yesterday I didn't feel any of this pain that I'm feeling today. But day one, even though the surgery was yesterday, it's day one without all that local anesthesia and all that stuff. But I will get back with you guys in a couple days, maybe tomorrow when I get home, maybe the day after tomorrow, so you kind of see how it is to be home. I'm not sure how I was gonna be able to be home because you have these special beds and stuff. You definitely need to look into something. If you don't have a recliner chair at home, you better try to get one because it is hard and it is tough to get up with this thing on from a flat line position. So luckily I talked to my physical therapy lady and they're going to try to get me like a wedge to go behind my back so I can sit in my bed sometimes. And I even asked if they could try and see if they would approve a reclining chair that will lift me up to stand me up because trying to sit up from a low lying position ain't happening. You can do it, but it's going to hurt you real bad. So this ain't nothing but probably about a 30-degree angle, and I was trying to get up from here and it hurt me. So you got to make sure you get something to sit you up or get somebody to help you get up. Really let somebody help you because you're going to need it. But outside of just being careful and stuff, it's not destitutional. Don't be scared or anything. It's not bad like I thought it was gonna be. Like some people on here made it seem. And I had 3 levels and a corpectomy, so it's not scary at all. Just stay faithful in God, and things is gonna work out for you. And again, I'll either stop by tomorrow and let you guys know how going home was, and then try to just keep you updated on the 2-week visit, physical therapy, and the things that's needed. But I hope this is helpful for somebody because, like I said again, I didn't really get the information that I was looking for. And I hope you guys enjoy it, and I'll see you on the next one. Bye.